All right, vaccination efforts ramping up at this hour. Right here in Alabama, about 1.5 million people are eligible now for that COVID-19 vaccine.
But the state isn't giving any formal priority to people with underlying health conditions.
Investigative reporter Brendan Kirby has been digging into this. And Brendan, it's got some people upset.
Yeah, it sure does, Lenise and Byron. You know, when it comes to the coronavirus, has proved much deadlier to people who have certain underlying health conditions. But the state isn't taking that into account when it comes to who's eligible to get the vaccine. Mobile resident Marn Yarbrough had a double lung transplant 3 years ago. He's lived in fear of COVID-19 for almost a year, taking few chances with the virus.
If I get it, it's going to kill me. I already know that.
Yarbrough is eager to get the vaccine, but at 56, he's too young to meet the current age threshold. And he doesn't have one of the jobs that would qualify him based on occupation. Some 98% of Alabamians who have died from COVID-19 have had a documented underlying health condition, according to state statistics. Chronic lung disease ranks third in the COVID death toll, behind cardiovascular disease and diabetes. 18 states have bumped medically fragile people closer to the front of the vaccine line, according to the Kaiser Family Foundation. But State Health Officer Dr. Scott Harris says that would be difficult to do in Alabama because he says 1/3 of the state's residents could be considered to have underlying health problems. Still, the state's top doctor says he hopes people will exercise their own judgment and hold off if they're not especially vulnerable.
We want those people to wait. Practically speaking, it's really hard to police that. It's hard for a clinic site somewhere to turn away somebody who's absolutely eligible because they think there may be somebody else coming in later who's going to be, a higher priority. It's a difficult thing to manage.
Dr. Randy Murphy, the Mobile County Health Department's top epidemiologist, says it's hard enough to enforce the rules already in place.
It's going to be, you have to be patient with us. It's going to be rather difficult to try to document eligibility in some of these categories.
But Yarbrough says it's not reasonable to have to rely on the discretion of others.
I don't think so. I mean, everybody wants the shot, or, majority of the people do. If it's your time, you're going to take it.
Public health officials continue to say that the biggest obstacle is a lack of vaccine supply. Until that changes, people like Marn Yarbrough will have little choice but to wait and hope they don't get sick. Reporting live, Brendan Kirby, Fox 10 News.